Hi, I'm Jim Cuddy, and this is Ask the Hearing Doctors. And I'm joined today by Dr. Anna Anzola, Doctor of Audiology with Hearing Doctors, the Washington, D.C. area's highest rated audiology practice with over 1,500 five-star reviews. Also joining us today, Brian Taylor, Doctor of Audiology and Director of Scientific and Product Marketing at Signia, which is the division of WS Audiology. I should mention also Brian is author of multiple textbooks, articles, and lectures related to clinical practice, hearing aids, and business management. Anna, Brian, great to see you both.
Great. Thank you for having us. Thank you for being here, Brian. It's been a
Yeah,
while.
great. It has been a while. Thanks for inviting me on.
Absolutely.
And today we're going to be talking about that connection between hearing technology and well-being, with a focus on early diagnosis and treatment, which leads to mental, emotional, and physical well-being. But before we get into that, Brian, if you could give us a little background on Signia and maybe even touch on some of the latest technologies that will certainly be related to our conversation today.
Sure, I'd be happy to do that, Jim. Signia is one of the leading hearing aid manufacturers in the world. It's been a hearing aid manufacturer for many, many decades. Many people might know the name Siemens. And until about 2016 or 17, Signia was known as Siemens when the division sort of changed hands and became Signia. Like all other hearing aid manufacturers, we launch new products, new platforms, new features about every 6 to 9 months. Just in the last few months, we've launched a couple of new features. One of them is a new app called My Wellbeing that allows people to track different parts of their day, activity levels, conversations, physical activity. We also launched a new form factor, Stiletto AX, which is a really slim receiver in the canal technology that looks really cool, looks more like a consumer earbud than it does a hearing aid. And then, of course, that all goes onto what we call our augmented focus platform, which is the underlying technology that has some really unique features that help people hear in noise.
How does hearing health link to general mental and physical wellness? We've touched on this on the program before, and Brian, I'd like to hear from both you and Anna on this. What you experienced as far as this goes.
So from our point of view, it's been so exciting to have, for the first time, actual health matrix that measure the well-being. And our patients are finding themselves being a lot more engaging. And for the first time, they can track what they're doing, how they're doing it, how long they've been wearing a hearing aid. We didn't have that before. And that in and of itself has really put them in the driver's seat to be in control of their health, including their hearing, and promoting better hearing health.
Well, I just would add that there's a lot of evidence that's been emerged over the last decade or so that show that hearing is directly related to many aspects of well-being, functional capabilities, emotional well-being, social activity levels, workplace activity. All of those aspects of quality of life are related to your ability to hear. Really, it's not too surprising to see that. I mean, hearing is one of the primary senses that we have. And as your hearing begins to decline, not only will it impact your communication in a negative way, but it also will impact your day-to-day activity levels, your cognitive ability, and your emotional status. So there's all kinds of relationships between good hearing and overall health and well-being.
Mm-hmm. We talked when I mentioned, early diagnosis, and of course the treatment and everything, but early diagnosis, what are some of the steps that individuals can take to lower their risk of hearing loss before it becomes a bigger problem?
Well, the obvious answer, I think, is wear hearing protection when you're around recreational or workplace noise. Sometimes people are surprised by how loud just everyday sounds in a restaurant or on the street can be. So you want to try to avoid those places. Wear hearing protection if you're in them long periods of time. Limit or monitor the use of portable earbuds like AirPods. They are often louder than people think. And there's a direct relationship between how many hours a day you wear something like that and your risk of acquiring a hearing loss. So that's probably the most obvious thing. Other than that, I think it's mainly around living a healthy lifestyle. We know there's a link between smoking and hearing loss, poor diet and hearing loss. And so you want to make sure you're avoiding smoking, that you're eating a healthy diet, that you're exercising. All those things will, leading a better overall lifestyle will prevent hearing loss when you're a middle-aged individual.
Anna, what do you see in when you're with people? Are they surprised at some of this information that you perhaps suggest to them that, hey, look, if you stop doing this, you'd be better off as far as your hearing goes?
Yeah, I think we spend a lot more time counseling our patients and talking about the comorbidities of hearing loss and cardiovascular disease or diabetes. And oftentimes they don't connect the two. But the reality is that they're there, and we're in the front lines of promoting better health overall. So it's not just better hearing health, but it's just better health. And again, having access to an application that can tell you what you're doing, your steps, number of steps, improving your physical activity, again, number of hours per day of daily usage, or even engagement. How great is it to know that you have been really engaged all day long and you're using your head and your mind to really, again, connecting the dots. Emotional well-being is just as important as hearing healthcare.
I mean, it's amazing to me what I've learned since we've been doing this podcast in terms of the links of hearing to everything with your
Yeah.
health.
Yeah.
As a kid, you have the hearing tests that are sort of mandatory, but after that, nobody really does anything until there's an issue. Are there any studies that suggest hereditary links? In other words, if my mother and father both had hearing loss, am I potentially somebody who's going to have hearing loss more so than the next person?
There is a strong hereditary link. You often, especially in younger individuals, children, young adults even, you see more attention paid to the hereditary linkage between hearing loss and your genes. I think that the vast majority of people you see in an audiology practice, if you're working with adults, though, have are more likely to have age-related hearing loss that doesn't really have any kind of a genetic component to it. I mean, it kind of does, but for the most part, it has to do with just wear and tear, being exposed to loud sounds, things like that over, several decades of your life.
And Anna, I know when someone comes to you, they recognize perhaps that they're having hearing loss or they're having difficulty with it. These are some of the questions you're asking people in order to find out what sort of treatment is best, correct?
Sure. We're very focused on our patients, focus on outcomes, best practices, even cognitive well-being is just as important. And we measure that and we have those conversations. And we find ourselves maybe even being the first professionals to have the conversation with our patients. And they're more prone to going to their neurologist if need be, or their primary care physician, addressing it much, much earlier.
Well, it's interesting, and Anna, you and I have talked about this in the past, where I'll go to have my annual physical,
Mhm.
and the doctor will ask me if I've had my eyes checked,
Mhm.
if I have been going to the dentist regularly. They've never asked me if I get my hearing checked regularly.
I know, it's crazy.
And when you think about all of the different associations with hearing loss, the potential health effects,
Mhm.
it makes me scratch my head and wonder why aren't they catching up to this yet?
Yeah. And it's really up to us, our profession, and our professionals to really invest our time to educate not just our patients, but their medical communities that we deal with on a regular basis. But I think it's changing. I really do. I think it's a really exciting
I,
time in our profession. I don't know about you, Brian, but I feel very blessed that we get to do this every day, that I get to be the one helping them. But it's not just hearing, it's the overall well-being of the patient that's really focused. And so we go be really beyond the years.
Yeah, no, I would agree with Anna 100% on that. I think that Well, a couple of things. In my observation I've been doing this for 30 some years now. More people now are engaged in preventive care. They
Mhm.
want to they want to identify problems earlier if they can. They want to engage in the process sooner. They usually come in more well educated, better informed. And I think that helps all of us. I do think also just society in general is starting to pay more attention to some of these negative consequences associated with age-related hearing loss, and a rising tide lifts all boats.
Along those lines, let's talk about the importance of measuring socialization for those with hearing loss to avoid things like isolation and depression. This seems like a really, really big one to me.
Yeah, thanks for the question, Jim. That allows me to talk a little bit about the Signia My Wellbeing app that allows people to track their activity levels, their physical activity levels. And also, there's a really interesting part of the app called My Conversations. And Signia has this, I'll call it a signature feature called own voice processing. It's been around for a number of years that uses machine learning, and the hearing aid knows when the wearer is talking, and it processes sound a little differently. Well, now with this My Conversation app, we engage or employ the own voice processing in another way, which is to track somebody's how much they talk during the day, because we think if somebody uh, engaging in conversation is sort of a proxy for social activity level. So now we have this really cool way to track somebody's social activity level each day. If they want to do that, they can track it and have a conversation with their hearing care provider about it. It's a great way to, Anna mentioned outcomes earlier. Well, here we have a way to measure or monitor outcomes when it comes to socialization.
And Anna, for you, uh, when you're seeing patients, you're helping them along with this to avoid that isolation, or maybe to bring them back out of some forms of isolation. How happy does that make you when all of a sudden there's that aha moment? I can hear my grandson, or I can hear my granddaughter again.
Right. It's amazing. It really is. It's not just amazing for us as audiologists because we've never had that ability. We've been good about dispensing a hearing aid and teaching them how to take care of it and, wear it every day because it's good for you, it's good for the family members. But now they're never going to say I'm talking too much, but they're saying, I was engaged and I was able to see it and track it. Again, I think just putting themselves in a way that they can be in control. I think that's phenomenal for them. They feel more empowered. They know about their health. That's important. They know about their numbers, and then they can make better decisions for themselves. It's really exciting.
Yeah, yeah. And as you say, and it's as happy for the family members as it is
Yeah, yeah.
for everybody.
And I think one more thing. I think it's important to say. It's also about their self-esteem. There's a correlation between hearing well, doing everything that you can to improve your scores, in optimizing your hearing, but also your daily activities. But your self-esteem, I think, is super important.
Yeah,
Absolutely.
If
Yeah.
I could echo what Anna said, I 100% agree. I think the key word there is empowerment, and these tracking apps are a great way to empower hearing aid wearers to stay healthy, to maintain a healthier lifestyle.
Mhm. In control. They feel that they're in
Mhm.
control. I like that.
Exactly. Mhm.
Right. Well, and like with so many things in life, when you have a bump on the road, you figure out, okay, how can I best work around this that I wasn't able to before? And this is certainly, these technologies are allowing people to live more normal lives again, which I think is pretty phenomenal. Uh,
Mhm.
what about some of the form factors or designs? Are there certain ones that consumers prefer when they're choosing hearing aids?
Well, I wouldn't say there's certain designs that consumers prefer. I think you could probably make a couple of general statements. I think people um, gravitate towards form factors or styles of devices that are smaller, that look more like consumer earbuds. And I also think the consumers like to have a choice. In other words, when they see what possibilities there are as far as devices that go in and around their ears, they like to be able to see that there are, more than a couple of different options, that there might be, half dozen different options.
Yeah. And I'm just going to add something else. I think I've been seeing more about the importance. What really is a priority for our patients is efficacies and efficiencies. They're sort of gotten away from I want something small, invisible. They like the rechargeability aspect. Does this have an app? Is it going to allow me to have X, Y, and Z? And that is important. We didn't really have that in the past as much.
There's research out there that shows, well, first, I think we have to know that only about 30 or 40%, that's being optimistic, about a third of people that have a hearing loss actually own hearing aids. So there's all kinds of reasons to improve that number of people that own hearing aids that need them. And there's some recent studies that have been done that show if they know that there are rechargeable hearing aids, if they know that hearing aids come in a variety of form factors, if hearing aids have an app that allow them to interact with the hearing aid and maybe even track some of these other dimensions of health. If you add those things to a hearing aid, many of these non-owners are willing to at least try hearing aids.
Well, I mean, and there's the big bulky thing hanging on my ear. I don't want to look like that in public, so I'm just not going to wear them. And now you're not stuck with that. You've got a lot of different options that get you over that hump, in addition to the advancements in other technologies.
Yeah. Let me just add something else that I heard from one of my patients. They really don't care if it's green or blue or orange. They really just care that they understand how it works, what they're going to get out of it, if it's going to be for them, not for anybody else. So, and they're doing it for themselves. That's huge advantages. So the colors and the things like that is not really as important as they used to be, I think.
That sounds like progress
It
in
is.
terms of audiology in general.
And emotional well-being, social well-being, cognitive well-being. All of these things really are all interrelated.
Well, it certainly, as we've discussed today, it starts with an early diagnosis. Go see a professional, get your ears checked properly. That leads to probably, I hope I'm safe saying, easier treatment, perhaps, leading to that mental, emotional, and physical well-being that we all want and should have in our lives.
Yeah, and early treatment. They're wanting to do something about it earlier on. We're not having to force it anymore.
Yeah. Well, Brian Taylor, Doctor of Audiology, Director of Scientific and Product Marketing at Signia. Of course, Anna Anzola, Doctor of Audiology with Hearing Doctors, joining us today. Thank you both very much for your time. It was a wonderful conversation, and we look forward to doing it again sometime soon.
Thank you.
Sounds
Thank you,
good.
Brian, for being with us.
If you're in the Washington metropolitan area and you'd like to schedule an appointment with Hearing Doctors, click the link in the description or visit hearingdoctors.com.